Good morning, everybody. My name is Ahnjel Ali. I am a licensed acupuncturist herbalist. My business is Ali Optimal Wellness. This talk is titled Herbs 101, How I Get People Healthy. And what can herbs do? Well, the answer is a lot. This is my wall of herbs. This is my herb room you are looking at. I have over 300 individual herbs that I custom make formulas out of. And like I just said, what can herbs do? Well, they do a lot. There are a few factors to consider for this. First, all plants have their biochemical makeup that makes each of them unique. As an example, tomatoes have a lot of lycopene, and that provides benefits to us. Carrots have carotenoids, which are completely different from lycopene. And those carotenoids in carrots have other health benefits for us. So realize that every plant is what it is because of its parts. So next is a matter of the adaptation, the will to survive that all organisms have. And this is the only reason any living thing is alive at all, is there has to be adaptations along the way, or that species won't be alive any longer. In the jungle, surrounded by a multitude of other plants and organisms, such as bacteria, viruses, fungi, and parasites, how is a plant going to protect itself in order to survive? Well, it has to adapt. That is how plants end up with those abilities to fight viruses or bacteria or fungi or parasites, as just some examples. Some herbs have antiviral activity, such and can help against enteroviruses like stomach flu viruses, the rotavirus, the norovirus, rhinovirus for sinuses. There are herbs that are effective against flu. And I've actually treated a lot of people with COVID starting in 2020 and even recently, and people with long COVID. These are other viruses that I have successfully helped people with herbs. As you can see, those are all the DNA viruses that we know of right now. Some herbs have antibacterial effects. And you hear about bacteria all the time. They're the common cause for different types of infections in your lungs, your sinuses, intestinal problems ranging from IBS to gastritis, colitis, food poisoning. And if long term, these are problems that can set off intolerances at which we are not the same as food allergies. So as an example, I had a new patient a few months ago with a 10-year history of chronic sinusitis. She had been on antibiotics numerous times, but the sinus infections always crept back. 3 weeks after her first visit and getting on herbs, she returned and had already had a 25% reduction in stuffiness, postnasal drip, and morning cough that had gone on for years due to the postnasal drip. Now her sinuses are not congested at all and no more postnasal drip or cough. She had bacterial issues. And then we have 3 different types of actual bacteria. So just as an example of what some bacteria look like. There are actually herbs that I can use for people that have autoimmune problems. And these herbs modulate the immune system. I don't want to stimulate the immune system when somebody has autoimmune problems because the immune system is already overacting and is overacting on self tissue. Nor do I want to suppress the immune system because the immune system getting suppressed means somebody is wide open for other types of infections. And that's the problem with medications used for autoimmune problems. They literally suppress the immune system and people are left wide open for even fatal bacterial, viral, fungal, and parasitic infections. So that's why I know I have herbs that make a huge difference to people in their quality of life and keep them healthy and get them healthy and stop autoimmune activity. This is an example of some of the autoimmune conditions that I have helped people with. There are herbs for stress, anxiety, and depression. These 3 conditions often occur simultaneously due to the biochemicals that are involved with each condition. I have helped many people over these 31 years with these conditions. Here's an example. A woman came in several months ago with extreme stress, anxiety, and mood swings. All of these occurred on a daily basis, and they were causing a big distraction in her work. I just saw her last week for her 4th visit. The stress, anxiety, and mood swings have been reduced by 75%. And that's just after 4 herbal formulas. And unlike pharmaceuticals that are often used for these conditions, she has no negative side effects and is only feeling good. There are herbs for hormonal problems, hormonal imbalances. There are herbs that change hormonal situations by attaching to the receptor sites for hormones, much like soy has a slight estrogenic ability because it binds to receptor sites for estrogen, but it is a very weak acting estrogen and will never cause as strong of an effect that our naturally produced estrogen has, and certainly weaker than the man-made estrogens that some women end up going on. So there are herbs that can help with infertility, PMS, as well as menopause. I've helped so many women with hormonal problems that as a result of my experience, when a woman came to me and needed me to basically put her in the opposite mode, she needed herbs to put her into menopause because she had survived breast cancer. She was on tamoxifen to put her into menopause, but she wasn't feeling right and was feeling several very concerning issues. One of those concerns was developing MS. Her brother, who was not much older than her, already had MS, and she knew autoimmune conditions ran in the family. I did find several problems caused by the tamoxifen. Her doctor agreed to let her try going into menopause with just the herbs, and they would run blood tests every 2 to 3 months. We saw progressively that her hormone levels on the blood test were consistent for menopause, and I was able to keep her in menopause on just the plants, just the herbs, while she needed to be, and it worked absolutely fine. And she is still alive today, thankfully, to talk about it. So that's just a small example of some of the patients I see and what herbs can do. And I wrote a book. I think most of you know about this by now. My book is called Mostly Vegan: The Science Behind Why You Should Eat More Veggies, because vegetables have phytonutrients. Well, that's what the herbs have. Herbs have those phytonutrients. Those phytonutrients are what provide us the benefits. In the beginning of the talk, when I talked about how plants have to adapt to their environment to survive, those are the phytonutrients they create. And those phytonutrients give us the benefits from the herbs, and the phytonutrients in vegetables also provide us the benefits. And that's why I wrote this book, is because vegetables have those phytonutrients. And I wrote a whole chapter about phytonutrients, what they are and what they do for you. And so you can learn from this book how beneficial intaking more vegetables can be for your health. What makes me different? My wall of herbs, which you see actually as my background, my education. After getting my license, I furthered my studies. I started reading Western medical studies, started using herbs from a Western standpoint, treating people for their bacterial problems, viral problems, inflammatory problems, and still keeping in mind my training in acupuncture college about qi and blood and yin and yang that also does exist. Also, my 31 years of experience make me very different from others in my field, and my perception after all these years of helping people with chronic complex problems and seeing the big picture. That's, of course, why I created my full body vegan cleanse program, which comes with 4 herbal formulas that I designed, and this book that literally is a blueprint for somebody to follow my 30-day vegan cleanse program while taking those herbs. So that's what my perspective brings, and my 31 years. A lot of experience dealing with different situations.